devices is an object or piece of equipment designed to help a patient with activities of daily living, such as walker, cane, gait belt, or mechanical lift. Assistive devices also allow the healthcare worker to transfer and move patients in a way that reduces risk for injury to themselves and patients. Important reminders: use assistive devices only if properly trained in their safe use. Always tell patients what you are about to do and how they should assist you in the procedure. Always perform a patient risk assessment or mobility assessment prior to using any assistive devices. Use proper body mechanics when using assistive devices to reduce risk of injury. Before a patient uses a walker for the first time, the walker must be adjusted to fit the patient's height. Walkers can be adjusted at the bottom by the legs of the walker. There are 4 legs that will be needed to be adjusted. The patient will lift and move the walker forward. All 4 tips of the walker's legs are touching the ground after moving the walker forward before proceeding. Then the patient will move the weak side forward, put weight on the hand grips via the hands. Then the patient will move the strong side forward. Crutches are assistive devices used to help a patient ambulate. Before a patient uses crutches for the first time, each crutch must be adjusted to the patient's height. Each crutch can be adjusted at the top and bottom. When a patient is learning how to use a cane, the nurse should apply a gait belt to the patient for safety. In addition, the nurse should stand on the patient's weak side during ambulation. When a patient is ready to start ambulating with a cane, the patient should place the tip of the cane about 4 inches from the side of the foot. To walk with the cane, the patient will hold the cane on the strong side, then the patient will move the cane and weak side together forward, and then move the strong side. Going up the stairs, the patient will move the good leg up onto the step first, and then will move the bad leg and the cane up onto the step. Going down the stairs, the patient will move the cane down onto the step and then move the bad leg down and then move the good leg down. Sitting down, the patient will back up to the chair until they feel the chair with the back of their legs. The patient will then allow the cane to rest on the side of the chair. Then the patient will place both hands on the chair's armrest and place weight on the hands and bend the strong leg while keeping the weak leg slightly extended and sit down in the chair. In getting up, the patient will place the cane on the strong side and keep the weak leg slightly extended out. Then the patient will lean forward out of the chair and push down on the cane's hand grip and chair's armrest. Then the patient will put weight on the strong leg and stand in position with the cane.